As long as I'm here, I feel like I'm very healthy. I'm becoming the healthier version of myself because of one thing only, because I now have medical practitioners visiting the studio every Thursday from 9 to 9:30. We talk about health-related matters. My name is Chacha. You can call me the Happy Fairy. I've got our first female guest from the Diamed Centre. Welcome to the show. Good to have you here, Viviana. Viviana. Now, you know what's interesting? I've never spoken to a radiologist. I've never had, the chance. Is that true? I don't think I've ever had, any chance to see a radiologist. How fun would you say your job is? Do you enjoy it?
Yes, I do. I mean, being a radiographer is one exceptional thing. Plus the fact that I'm a woman. It's one profession that is being dominated by men.
Right.
Because of the whole radiation thing that surrounds it. But yeah, it makes me unique.
Let me give you this applause real quick. Come on. I love it. See, as you just silently corrected me, I was saying radiologist. You said radiographer. Is there a difference? Because now radiation, damn.
Yeah. Radiologists are doctors that specialize in radiology.
Okay.
But then a radiographer is someone who studied radiography.
Okay.
Yes.
Okay.
So radiologists interpret images, but then we have the radiographers that do the capturing, and then the whole baseline of attending to the patients before the radiologists now come in to actually view the captured images and then interpret.
Okay. I bet that if I was to choose a course back in the day, I did choose my course by myself. I wanted to study theatre arts, but my parents said, God forbid, you cannot study theatre arts. I said, okay, what is creative? And I went for mass communication because of advertising. I can imagine that I could have had a situation where I'll see radiography and I think it's radio and I'll click on it. I would have found myself in the hospital. I don't know how I would have survived. But yeah, it's good to know. Let's talk about one of the common things that you do as a radiographer is breast screening. That's our topic for the day, is breast screening and self-examination. Now, I had years back, I had to have a surgery, and I was talking to somebody on the phone, and then I just, felt my breast. And the next night I felt something. I just said, hold up, let me call you back. I got off the call, and I was like, I ran to my parents. I was like, Mommy, touch something. I'm feeling something hard. My mom wanted to lose it. Like, she was like, what's happening? We're going to the hospital. We went to the hospital, and the doctor said that I had lumps. Okay. 2 weeks later, before the surgery, doctor said there was another one. I was almost losing my mind. And I was thinking to myself, I mean, if I didn't just randomly touch my breast, how would I have known? Now, what is breast screening and why is it important?
Okay, so breast screening is a medical procedure that we use to actually check the breast for any abnormalities or any lump. Just as you said, you touched yourself and you felt something. Obviously, that automatically means that you know your breast.
Right. Because
most women don't know their breast. So it's actually very important, because if you know how your breast looks, how your breast appears, the size, the shape, you would be able to tell if there is anything that is different at any point in time in your breasts.
Who needs breast screening, and what age should women start?
Every woman.
Okay.
But then it's not limited to women. Some men do need breast screening.
Is it the ones that have big breasts or normal breasts? Is it
those that have
big
breast tissues?
Okay.
They actually need to go in for screening. But mammograms are specifically for women above 40.
Okay.
Unless we have people who have it maybe hereditary, or sometimes they usually say that if you're coming from a home that you have any of your relation that have previously had a breast cancer, it automatically means that you have to often check.
Right. Okay.
Yes.
So is there a difference between breast screening and diagnostic imaging?
No, not really, because breast screening is basically imaging of the breast.
Okay.
So for you to actually take a look at your breast, it has to be diagnostic.
Okay.
Because that would tell if there is something wrong or there is nothing wrong.
Very well said. You mentioned mammogram. What is that again, and how does it work?
Okay, so mammogram is an imaging modality.
Please.
So
You say what? No, give me
imaging.
Okay, I thought
modality.
you gave us some medical terms. I say, I beg, help us.
It's an imaging modality, just like we have ultrasound and MRI. So we have mammogram, and ideally, mammogram is the primary point of care when it comes to breast imaging because it detects early cancers.
Okay.
Yes, but then when women are below 40, they have denser breasts.
They have what? Denser.
Denser breasts.
Okay.
So they advise them to go for ultrasound.
Okay.
And for people to also know, people have this idea that breast cancers are very common in elderly women. That's not true.
Oh, really?
Yes.
Okay.
We have younger women pass through breast cancer, and it comes from this attitude of it cannot be me, it has to be someone who has actually gotten advanced. No, that is why it is very essential to have your breast screening done.
You mentioned something now. You said dense breast. What's that? Because some people might not know that they have dense breast.
Okay, so in the breast tissues we have the fibrous, the glandular, and we have fats.
Okay.
So denser breasts are those that have more of the glandular and fibrous tissues, and that is for younger persons. Now, if you've seen a mammogram, it appears dark and white, kind of. Now, if you have a dense breast, it's going to appear white.
Can you only tell the breast is dense from
Imaging?
Okay.
Yes, exactly.
So is it bad to have dense breast?
No.
Okay.
It's not. I mean, I think it's a thing of age.
Okay.
So the more you get advanced, normal changes that happen in the body just occurs.
Right.
So as you get advanced, it becomes less dense.
All right, Vivian is in the studio from Diamed Centre. We're talking about mammograms, self-examination, breast screenings, and every single thing that you need for the next couple of minutes. My name is Chacha, the one and only Happy Fairy. We were talking on mammograms, and we're also talking about the dense breast before we went on the break. But a big question is, mammogram, is it enough testing or screening rather for someone who has dense breasts?
Well, sometimes you could. Okay, so mammogram is for patients that have less dense breasts.
Okay. Now.
Okay, the ultrasound is for patients with dense breasts. Okay, so now if you have a mammogram done and it comes out inconclusive, that is one major challenge with mammograms, especially when you have 2D machines. And that is why recent researches have brought up advancements in breast imaging. Now we have 3D mammogram machines. Now, 3D means it gets images in slices.
Okay.
So it like cuts, instead of getting just one view of your breast, it gives you like 9 views.
Oh, wow.
Now, even the tiniest lesion in between any duct will be found.
Okay.
So if you go for a mammogram and it's inconclusive, and you still have probably persistent pain or something that keeps worrying you, you can now go for MRI.
Okay.
And sometimes they could also tell you, maybe you should go for ultrasound. They could be seeing something that they want to differentiate if it is cysts or if it's actually a solid lump.
Okay.
They could tell you, maybe you should add ultrasound. And if they are still not satisfied, you now go to the advanced imaging, which is MRI.
You know what? Every time I speak to someone from your field, I kind of feel a little bit dull because I was just thinking to myself, ultrasound. Every time I've thought about ultrasound, it's only during pregnancy. I'm like, ultrasound, it's just for pregnancy. I didn't even know it was a term used for other things.
It's not only for it's not only for pregnant women. You use it for literally every body part.
Okay.
You use it for your abdomen, you use it for your pelvic, you use it for MSK studies, you use it for Doppler. You can even check your veins, your arteries. So it's actually vast.
Okay. Big question now. Should I know there's nothing wrong with me. I'm hoping there's nothing wrong with me. Can I just walk up and say, let me go and get a breast, scan my breast. Let me go and check. Let me get a mammogram. Is there a reason why I should go for it?
That is why it is called screening.
Okay.
And there's this thing people always say, I'm okay. So because I'm okay, I shouldn't go to the hospital.
False.
And the thing about mammogram is that breast screening helps to detect early. It won't solve the issue. So imagine you are asymptomatic and then there is nothing going on, you're just fine, and you go years. You don't check your breasts. You don't even know if probably it has changed shape. One could actually be bigger.
Right.
But because you don't actually look at it, you're like, it's normal. But if you actually look at yourself and then you check your breast and then you notice, oh, this is not okay, you could actually go. But even if you feel you are fine, routine screening is very necessary. I'm sure that's why most people do annual check, you do wellness check once in a year. I mean, it's fine. It's not something you do often, so you can just do it once in a year and that's it.
I don't know why my heart skipped as you were just talking. Anything hospital. Hey, the thing just famous. The crazy thing is, sometimes it's like, please let me not just know. Let me just. Well, I know that's bad. I really know that's bad.
Yeah. People need to change that ideology. It is very. I mean, if I should give this illustration, we'll have a car. I'm sure you don't wait. You don't wait for your fuel to get to empty before you find yourself always checking. Is he almost empty? Is he almost finished?
As you mentioned car, I was going to say that. Of course, you would know that the type of person that I am now. I have my dashboard, all the lights are on. This light is like a disco light. Anyone who enters, they can say, take it to the mechanic. It's still, I start hearing, then I'm like, okay, you know what, let's get this checked. But let's go back to self-breast exam. What is it and how often should it be done?
Okay, so it's just a method of getting very familiar with your breasts.
Okay.
So there are 3 points that you actually have to focus on when you're doing your self-breast check. One is to actually look. You have to look at yourself. Go to the mirror. The same way you admire and put on makeup and all those beautiful things. You go to the mirror. You admire your breasts.
Right.
Look at how it looks. The shape, the size. I mean, if there's something different, you will definitely notice. And the best time to actually do this is few days after menstruating.
Okay.
Because, when you're menstruating, people get to have tender breasts, fuller breasts. But then after some days, it returns back to normal.
Okay.
So let's say maybe 5, 6, 4. It just depends on your body and your body type. So if you go to the mirror and you first look at yourself and you check the shape, you actually check if probably your nipple that is supposed to be pointed is not retracted. It's not inverted. Yes, so it's actually a problem if you notice that.
So inverted nipples are bad?
Yes, it's not supposed to be retracted. Your nipples are
out.
So when it's in, there's something wrong.
Oh wow. Okay, just so you know, just look at yourself in the mirror first.
Then after that, you feel. So I suggest you feel 2 places while lying down and at the shower.
Okay, why shower?
Because at that moment you're wet.
Okay.
And then it's easier for you to actually feel through. Most people could actually suggest putting oil on their body. But it's best when because you're already naked.
Right.
You can actually feel yourself completely. Because when you're just doing it you're doing it in a way that you just want to oil yourself and just check, you might not take your time.
Right.
But if you're going to shower, you've dedicated this time to actually feel your breast, then you can now continue with your shower. So if you lie down, you use the 3 finger pads and just in circular motions check the whole of the breast up to the axilla, that's the armpits. So you check down and be sure, because sometimes you could even have lymph nodes.
Okay.
But then some nodules are normal, while some are not normal. But then you have to go to the hospital to be able to tell which is normal and which is not normal, and that's where the breast screening comes in. Remember, this is just the check.
Right.
That we're
now,
doing.
You said lymph nodes. God, I beg, help us. But what kind of changes or lumps should someone raise concern? What are lymph nodes as well?
Okay, so lymph nodes are like nodules. But most times they are benign.
Okay.
So, sometimes you could actually use a deodorant, and then you wake up, you see something in the breast that feels like a lump, just a rounded something, and you're like, what's it? And then you go to the hospital, and when they check, they just say, oh, these lymph nodes.
Okay.
They're just something that most people, it could be reaction.
Okay.
Most people, it's just a normal thing that just pops out. Maybe you've been having pain. Like usually when I was small, when I have a very severe pain, I tend to have this swelling just towards my pelvic area. After some days, it just goes down.
Okay.
Yeah, but then when you now go and then you check, and then the appearance, that's if you've done screening, and then the appearance is not normal, that is when they cannot tell you, oh, this is pointing towards cancer, or this is pointing towards an abnormality. Please go for further screening.
So if I check myself now, what kind of changes should I be worried about, or what type of lumps should I be worried about?
Okay, so if you check your breast and the shape is different, let's say one is now extremely big, bigger in size than normal, or you try to squeeze your nipple and you're seeing fluid coming out, that's not normal. Or then you see this firmness, a part is extremely firm. Breast is supposed to be soft, but then you now check maybe your left side or the under part is very firm, it's a problem. Or a part is very red or severe pain, that's a problem. So you could actually check. I mean, hormonal changes too has its own play when it comes to the breast changes, but it's better you go and screen,
right,
instead of concluding that, oh, it's just a hormonal change and then it's now something serious.
If someone finds something unusual in their breasts, what should they do? What's the first thing that they do?
See your doctor.
There's no home remedy.
See your doctor.
So there's no let me put cold water or hot water.
No. See your doctor, please.
Now, a lot of people are scared. What would you say to women who are afraid to get a mammogram or to get screening?
That is something I really need to let them know, because I don't know if it is this exaggerated thing about mammogram pain, but I get a couple of patients saying, oh, I don't like mammograms because it's painful. No. And thank God for this advancements now. Most 3D machines, in fact, if not all, are not painful.
Right.
I mean, you can say, oh, you feel uncomfortable because, I mean, it's not easy to assume a certain position when you're having your mammogram done. But it's not painful. The whole mammogram procedure has to involve compressing your breast just so your tissues can be well spread. So that's where the uncomfortable part comes in.
Right.
Because, imagine squashing. They say squashing. Squashing the breast just because they want to get very good imaging. But it's not painful. So please, if you can hear my voice, please come for your screening and have your mammogram done. It is not painful. It is just uncomfortable.
So what are the biggest mistakes people have made when, or you think people make when it comes to breast health?
Okay, I think the major mistake people make is ignorance. So many women are ignorant. I mean, if I should ask Chacha, when was the last time you checked your breasts?
This morning.
Oh, really?
Yes.
Applaud.
Actually, no, not this morning. Last night. Morning.
That's nice. That's nice. But so many women are actually ignorant about this, because they feel, because there is nothing wrong with me, I feel fine. I don't need to check my breast. That is a very common mistake. And honestly, if it could stop, the rate of breast cancer would reduce.
Right. Are there any lifestyle changes someone could make?
Yeah. I mean, junks. These days we eat a lot of junks. And honestly speaking, lifestyle matters. If you're always eating things that are extremely not healthy, it's not good for your health. Because we don't even know things that have some carcinogens in them that we just take in and then we eat and then they accumulate over time. You're now having issues that are related to cancer or issues of the breast. And also, sometimes cysts could actually come out in the breast. There is this thing I need to clarify. Having a cyst is different from having a lump.
Okay.
Now, if you have a lump and you go to the hospital, you still need to confirm, because they all feel the same way, kind of, because you would feel the stain in your breast.
Okay.
But it can only be when you go to the hospital that you can now tell, oh, okay, this is just a cyst, which something as little as fine needle aspiration can sort. They just aspirate the fluid in the breast and then place you on probably antibiotics, and you'll be fine.
Right.
And then, even if it is a lump, there are some lumps that are benign. Not every lump is actually malignant, that's cancerous. I've had friends take off lumps.
I have taken off too.
You see, and that is because you detected it on time. It could only grow into something very serious if you ignore it and you leave it. Yes.
You know, I was thinking to myself that I could have gone around with my life without.
No.
So
honestly,
benign lumps can turn into something else.
yes.
Wow, I didn't know that.
Yes, because something that you keep a fruit here and then the fruit is good, and then you come back after this, it's rotten.
Yeah.
That is because you placed it where it shouldn't be.
Right.
If let's say you refrigerated it, it could stay days and nothing happened. That's the same way you have something that is not normal in the breast.
Oh, wow.
And then you leave it over time, it could actually arise into something terrible. So it's best to actually check. If you go to the hospital and they tell you, oh, it's just a cyst or it's just a lump that shouldn't be a thing of concern, they could give you time. Okay, let's see if it is growing. If it's not growing, fine. They could give you a medication and say, oh, this could actually reduce it. Let's see if it's going to shrink it. But if you're doing all of that and it's still there or it's still growing, please go and look for a solution to it.
Fantabulous. Oh, thank you so much. You've dropped so much gems on us. We're going to have to take just a few questions. Apologies to those phone calls we missed. If you want to call back, you can still call back. The number is 091 662 16,000. This one says, hello, Miss Chacha. My name is Edwin, and I have 2 questions for your first female doctor. She sounds so good on radio, by the way. Here are my questions. It says, with the rise of AI in medical imaging, do you think machines will ever replace radiographers, or will the human eye always be necessary?
No. They cannot replace radiographers.
Okay.
Because imaging is user dependent most times.
Okay.
You have to be smart. You have to apply some techniques. There's some certain things that I would do that it's not what I'm supposed to do. But because I know this is what will suit this particular patient to actually detect that particular pathology, I have to deviate. And trust me, that is something AI do not have.
Come on. Just say shut down. Please leave AI out of this. Also says, people always say one breast is naturally bigger than the other. As a radiographer, who actually examines breast health through imaging? Is that true? And if it is true, at what point should someone be concerned about this asymmetry?
Okay, that is not medically proven. Now, sometimes the shape of the breast can be different.
Okay.
If this is fuller and this is not as full as this, it's not going to be that this is extremely big. No. They would almost look the same, but then you will just feel that this is actually fuller. But you will always notice if there is something wrong, because if this is fuller and then this is less fuller and there's something wrong with this, it will get extremely fuller. It won't be the normal, oh, okay, this
one
is
watermelon
fuller
and
this. You didn't have to say that.
Sorry. I couldn't. I couldn't.
So sometimes, honestly, I mean, I get a lot of people say that, but when you look at their breast, it actually looks the same. It's just that the shape makes one appear like it's actually bigger than the other.
Very well said. Thank you so much, Vivian. Do you have any advice or any final thoughts you want to put out there to someone?
Yes. Early detection is key. Please go for your screening. I know we're even talking about breast, but also men should go for their prostate screening. Because the rate of prostate and breast cancer is so high. If you don't check, you won't know, trust me.
Right.
Because these are things that could actually grow very, very fast. And if you've never actually gone to actually check, you will not have an idea.
Very well.
So you save yourself the stress of going through something chronic. You save yourself the stress of actually finding yourself in a very bad situation, and then you feel healthier. Because I mean, if I check my breast every day and I see that, oh, there's nothing to worry about, I feel happier. I can wake up and go about the daily activities knowing fully whether, oh, my breast is safe.
At least that part is okay.
That part is safe. But then it's good to also go for screening.
Right.
So if you are scared that mammogram is going to cause you, there's this thing that people say that mammogram causes cancer.
Yes.
Because of the radiation. Please, the amount of radiation dose for mammogram is in fact is lesser than the environmental radiation.
Oh wow.
We have environmental radiation. Things when you're using things like your phones, things like your microwave, they have this radiation that comes from it. Mammogram is lesser than it.
Wow.
So there is actually nothing to be scared of, honestly speaking. So please, you don't have any excuse. Go for your screening.
Come on. I love it. Thank you so much. Do you have socials that you want to share out? Do you have a way people can come to you, reach you, get to you?
Yeah, I have my YouTube page, my YouTube channel, That Radiology Girl, and that's also my Instagram, That Radiology Girl.
Very well said. Thank you so much.